Get some hands up with that one, right? So you guys are getting interaction and interface with people who are cannabis advocates here. So we tend to be some of the minority of physicians in our community. And so I want to let you guys know that there is another side out there that you should be aware of because, well, that's a predominant side in medicine in which we see today. I don't have any disclosures for this conference. I have worked with some CBD companies in the past, most recently Gold Leaf Spectrum CBD, but I'm not under contract currently. So today we're going to talk about, we think our healthcare system is standardized, but really it's not. Depending on time, place, geography, race, sex, sexual preferences, you name it, everything can be different at every single interaction. And so this is the tough part that we have to come to grips with, let alone with cannabis. And cannabis, there are many reasons why physicians, hospitals, clinics may or may not support cannabis. And it really has nothing to do much more than just their personal opinion. So we are gonna make sure you have your approaches set for your businesses or you as individuals when you want to talk with healthcare providers and consumers, and use, sell, distribute your cannabis unapologetically. So we're gonna go back in this lecture today. We're gonna talk about this kid right here. And so when we talk about this kid, as he was growing up in his neighborhood, he would ride his bikes, he would see these big trucks roll by, and he wanted to do nothing else but to drive a Budweiser truck when he became older. His parents, they were supportive and said, okay, you can do anything you want. If that's what you want to do, you can do it. And as time moved on, I still had a fascination with trucks, but science came into my life a little bit at that point, and I started getting interest into science when I was in high school. So I thought to myself, chemistry seems pretty interesting. Maybe I could be a chemist. And I went off to Xavier University of Louisiana, studied chemistry, and got in some of those labs and said, this is kind of boring. Sorry if there's any chemists in the room, true chemists. I'm a fake one. So I ultimately decided that for me, my interpersonal nature, the way I like to interact with people, I wanted to make sure I was going to be helping people in a way that I could work with them face to face, which led me off to medical school. I went to Case Western Reserve University in Cleveland, had some of the worst winters of my life there, and decided to get out of town, moved to New York City, completed my residency at NYU, and that's where I really developed my love for pediatrics. And that came in kind of early, even when I was in medical school. I had the opportunity to practice internationally, and I went to Ghana, and I was fascinated by the people and the children. You see me in this picture here, hanging out with a bunch of kids, just wondering who I was and why was I so tall and this, that, and the other. So, I tell them I play for the Sixers or something like that, and they think I'd be the coolest thing ever. So I'm off in practice. I am doing the things that I love to do. I'm taking care of patients, and with time, I got to have a little bit more influence in the policy era. I became a director of a clinic, ultimately became a division chief of a general pediatrics, so I was really working on policy. Ultimately became the president of the medical staff, overseeing 1,400 doctors in about 8 hospital systems. So it was an incredible job where I was still seeing patients on the front line, but I also was able to change policy and influence some choices that went on to do some pretty big things. So I really thought I was living my passion, I was living my dream, I was doing all the things that I wanted to do. And, suddenly everything changed. I had a meeting with an attorney, one of the hospital attorneys that I always met with. And the attorney had a look of anguish on his face, sat down at the table, he looked at me, said, Jared, I don't know how to tell you this, but you're under investigation. Yeah, that's kind of like how I felt. I was like, what are you talking about? What is this? Starts going through pictures. Do you know this person? No. Do you know this person? No. Do you know this person? You know, I said, what is going on here? What are you talking about? Well, turns out that there was, you saw this 9-month-old child, you saw this mother, and she's claiming you were sexually inappropriate with her, and she's going to the police. Everything stopped. Completely stopped. I'm sitting in this glass-walled room, feeling like I'm in a vacuum. My entire life changed from that moment on. And she held true to her promise. There's no doubt about it. Police showed up, did a little quick investigation, looked at me and said, yeah, we'll file some charges on him. I still can feel the cold steel handcuff crushing the bones in my wrist as they led me off to the paddy wagon. Of course, there was a media storm. I'm a board member of an 8-hospital system. I'm a high officer in this place. People chasing around my neighbors, people chasing around friends, family. It was a disaster. And I'm sharing this moment with you because it was a moment in time, but it didn't define me. It didn't define who I was going to be, and I knew I could not change the situation in which I was in. So finally, 18 months of my life sitting on the sidelines, because needless to say, after the arrest came, well, the medical board showed up the next day. There's some sort of complaint against you, we are taking your medical license. That was in Pennsylvania. Then New York heard about it. Then the other states I had licenses heard about it. A few weeks later, knock on the door. I was getting used to my postal carrier, Kelly. She would come hand me certified letters all the time. You know, she probably kind of knew what was going on, but you know, she was still so kind. And some DEA agents knocked on my door. And they sat there and they said, okay, well, this is interesting. I'm not really sure why we're here to see you, but we're told to take your DEA license. They said, asked me if I wanted to put on some clothes. I think it was early in the morning. I just got back from the West Coast. And they were there. I said, well, are we going somewhere? I said, you know what, I'm tired of this. Look, I'm talking to my attorney before we even go further in this. I said, well, is there somewhere to eat? Yeah, sure. You can probably go somewhere. I'll come back later. So we handled all of that, came back. My attorney said, look, it's in their right. It's like everybody else. They can do what they want. You're just getting kicked around in the system. Fine, I'm used to it by this point. They took my stuff, signed over the papers, and one of the agents said, you know, you seem like a nice guy. I don't know what this is doing. In Philly, this doesn't fly. I'm surprised that this is even going on. But, you know, when you recover from this, you can go open up a Suboxone clinic. You'll be right back. And I'm like, I'm a pediatrician opening up a Suboxone clinic. This makes no sense. What is this guy even talking about? Just get out of my face. Bye, we're done. Eventually, I did have my day in court. 18 months later, I was able to finally prove my innocence. And throughout the stages of this and trauma in my life, I realized that these administrative bodies, they can do what they want because they write the rules. And this made a difference, and that's kind of where we are here today. Some good things happened. I wrote my first solo book, License to Live. It's a best-selling book, award-winning book. It led me to a lot of different things as I talked about my story and talked about how it affected me. And I've been over the media all over the place in a good way this time, and not just the kind of way like, dun, 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 you know, look at this guy, and having me look like, you know, they're giving all the bad footage. So, you know, that's a picture of me in the bottom corner at Good Day Orlando. I've had some couple times at the Sirius XM studio, CNN, WABC in New York. So all of these things telling a story, because the key is, as you're going through medicine and you're going through these things, you are defined very narrowly. Your training is very narrow, and you're only told, so much in what you know at the time in the science. And so this is why I'm here today. You say, okay, he went through this long-winded story. Aren't we here about CBD? Yes, we are here about CBD. I don't want to get away from you yet. But this whole experience said to me, and I learned, there's a lot more to medicine than I would even claim to know. And not only that, there's a lot more to a lot of things that, although as a professional, as a physician, I am supposed to know everything and be able to help people and help their families and go through this and that, there's so much more we don't know, and so much more that our patients want to do that sometimes we just shut down automatically. So I started learning more about cannabis. And in fact, with cannabis, I realized that there are a lot of different treatments in any kind of way that you need to use it. There are a lot of scientific studies, but I didn't know anything about it. I thought it was like snake oil or something, and something that people just did because maybe it made themselves feel better, maybe they got some benefit from, but it didn't necessarily come into any of my training that I knew about. Not to mention, there was a change going across the nation. People across the states were either, especially on this side, you guys, if most of you guys are from the West Coast, this is nothing new to you guys, but those of us on the East, South, Midwest, there is a change happening where you see, and in fact, this one is already outdated. This stuff is coming up so quickly, where you can use CBD, you can maybe some places have medical marijuana, and all of these things are fitting together for the betterment of the people. But the last thing I wanted to say is that all of this has led to an incredible interest in, on 4/20 next year, you'll see the release of Us versus the Plant. This is a film that I've been lucky to be involved in, and that's a picture of me kind of studying my script. It's a documentary going over the history of the plant that we have such a problem with in America. So look out for that, and I think that'll be something fun for you. But let's get to this bipolar nature of our community. When we think about the level of training that doctors go through, doctors are considered specialists. They go through a training, and for pediatrics, it's on the shorter side. I went through 4 years of medical school and 3 years of a general pediatric residency. And some of the things that get in the way is, well, you learn so much as you're going through. You learn so much after you go through. You learn a lot more as you're going through practice. And one of the things that gets in the way is intelligence here. Now, all right, before you guys start going off on me, here's the doctor talking about how smart doctors are. Just bear with me and you'll catch my point. But doctors go through a lot of training. And there's only so much training in traditional Western medicine where most of our doctors get medical degrees or doctors of osteopathic degrees and study and practice medicine. We're expected to know everything because, well, when somebody's sick, well, they want to be fixed. They want to find some sort of treatment, some sort of plan that's going to actually work for them and get them to come back and do something better. And, well, sometimes doctors will think we know everything, and we don't even want to listen to what anybody else says. And so sometimes these relationships can be tenuous. But that pressure of knowing everything, especially in an emerging science, it's there. In fact, in a traditional medical education, you're going to learn about the cardiovascular system. You're going to learn about the pulmonary system. You're going to learn about the neurologic system. You're going to learn about all these systems. Never once, and this goes into our training well into the 2000s, never once heard the word endocannabinoid system. Have you guys heard about that? I think so, yeah. Since you're here, I'm sure you guys have seen that. Never once heard endocannabinoid system. So, okay, for the stats, they may have a higher than average IQ. Right? Just remember, this is just IQ. So I'll tell you a story about intelligence. After a conference, I was in New York City, kind of long day. I stumbled into this pub. A couple people buzzing around, but some guy was just randomly serving ice cream in the back. I said, this is weird. But anyway, get up there and I just said, it's that kind of day, I could use a cup of ice cream. Turns out when I get up to the front of the line, this is Jerry Greenfield of Ben & Jerry's. Yeah, right. I said, oh, really? I'm getting ice cream served from Jerry. He served me up this, salted caramel crunch. And I was all excited, and I really wanted that Cherry Garcia. Okay, well, I'll just take this because I'm so excited. But one of the things he told me is that he applied to over 20 medical schools when he was in college. Got 20 denial letters, and he didn't know what to do with his life. Because all he was worried about was becoming a doctor. So he teamed up with his friend Ben. Jerry went off to Penn State University, spent $5 on a correspondence course on how to make ice cream. And I think you guys know the rest of the story. So we know the guy on the left is the most intelligent guy in the room, or at least in this picture, right here. So he really figured it out and did something different. And as you guys may be aware that, well, they're looking at having CBD in some of their ice cream flavors. And they announced that earlier this year. So I found all of this very fascinating. But there's a lot more to it than IQ, which is why I want you guys to bear with me for this a little bit. We can talk about EQ, AQ, SQ, PQ, and a whole other slew of Qs. The EQ is your emotional intelligence. And that really goes around how much you can sense what people are feeling, what people are doing around you. You have your adversity quotient, so how well do you handle adversity? And after what I've been through, I said mine must be pretty high. I've never had it tested, but it must be. I'm still here. You get your spatial quotient, physical quotient. There are a bunch of these things that go into this, and sometimes, it'd be nice to have a balance across all of these, but we are all different individuals, and we all have strengths and weaknesses in these different categories. And this is why we're talking about this as one of the reasons why the medical community is bipolar. Sometimes when one of your quotients is really high, some of the others aren't very high at all. And that causes a big problem in the community. Are there any people who have seen or heard of the show Scorpion before? Scorpion is a show, I believe it's on CBS, and it's based on a group of super intelligent people who have different levels of these Qs, that they work together, solve problems, and go save the world, essentially. And I had the opportunity, this is the Scorpion on the show, who plays Walter O'Brien, who is the real Walter O'Brien is the guy that I'm in the picture with. Again, the guy on the left is the most intelligent guy here. In fact, the most intelligent guy I've ever met. He's literally has broken these IQ tests. So he's just one of those people that are so special and so special out there. But we're having a conversation about intelligence and what do you do when you have these different intelligence. And he said it's very hard to go through these challenges of having people who have all of these strengths and they aren't able to use them in other ways. And again, this is where we are as a community, and this is where we stand today. Another issue is the knowledge deficit. The cannabis science is emerging, it's changing, and it really didn't get a hold of itself until the 1990s. And in fact, when there's something that is changing so much, like so many things in healthcare are changing day by day by day by day, it makes it hard for people to keep up. And so then people may just shut down. They may not even listen to what's going on because they don't know or they can't comprehend. Well, this was in none of the textbooks. that I had previously. For the majority of practicing doctors, we're talking about people that may have trained as recently as the mid-2000s. Again, the endocannabinoid system wasn't even mentioned. So the vast majority of physicians, hospitals, clinics, nurses, everybody who is taking care of our health, they really don't know about this stuff. You really have to go out and be aware, do additional training, learn from additional people to understand the science and what's really going on and how cannabinoids can help people. And so there was so little to know at the time. The ideas, the biases, the community, the opinions, and old knowledge that people have is just what they go on because they don't know anything else. They didn't know there was a whole new science around this. So it's very difficult to know. And in this slide, I just wanted to let you know that, well, they just started figuring this stuff out in maybe the late 80s and through the 90s. So even if you trained, as I did in the early 90s, again, it wasn't even a part of what we were doing. In fact, this textbook on the right is one like I used when I was in school, and I have to read out of this book because it it will tell you a lot about what we thought about marijuana at the time. Marijuana ended up being in the same section with drugs of abuse. So I look at this chapter, and the chapter talks about having cocaine. Lists all the problems with cocaine and what's going on, and now there's crack, and now there's this, and now there's that. The next section was marijuana, where there's about a page and a half. And I just want to read you a little bit from this, because they didn't know a whole lot about it. This is what they were teaching. The National Institutes on Drug Abuse 1995 report states that marijuana use, particularly by adolescents, is increasing significantly throughout the United States. Drug-related emergency department admissions increased greatly throughout the United States between 92 and 93. Most of these patients were males between the ages of 18 and 25. Marijuana-related emergency department admissions for males between the ages of 12 and 17 escalated by almost 100% during the period of 1991 to 93. Now this is my favorite part. This is in the medical textbook. Marijuana-filled cigars, from which tobacco was removed, known as blunts, were increasingly smoked by young adults in urban and some rural areas. I mean, nobody needs to go to medical school to learn this stuff. I mean, really, this is what they're teaching. This is what they're teaching, and this is what I'm trying to let you guys know, that the vast majority of people are simply unaware of the power of cannabinoids and how it can help so many different conditions. So this is not a joke. This is very difficult to overcome, and we're still learning so much more. And I know you guys have been a part of a number of these different lectures that have gone through a lot of the science behind it, and it's amazing. And so we have to pay attention. So we need to have some advocates out here. The other point is the legislation. If you remember that map that I showed at the beginning, each state has different rules and regulations on how they want to regulate CBD, how they want to regulate THC products, and the hospitals and clinics get caught up in the middle because there's no federal oversight for the most part. Hospitals like, well, we can't touch this because we take insurances, and insurances don't pay for some of these cannabinoid products and medicines and this, that, and the other, except for the one that was finally approved for a few pediatric indications for severe seizures. However, few of the hospitals and big systems offer these clinics today. So you may go to one of your university or academic people, and they may have 1,000 or 2,000 physicians on their staff, and they'll let maybe 1 or 2 people or a small group of people actually learn and maybe treat. Maybe they will hide them in the pain clinic, maybe they'll hide them in the oncology units, but there are very few of them that will actually be able to help people and give them access to do this. And that's really one of the reasons I started my cannabis practice in Pennsylvania, because the availability of people to help people who want to try an alternative therapy is just not there, and it's still not there very much, particularly in these emerging states that aren't as advanced as you are here in California. Then people aren't sure what to do with their staff. Well, if we're calling it a medication, why are we testing people for it? If it's really a medication, why do we care if they're using it? Why shouldn't it be like any other medication someone may take for high blood pressure, anything like that? And we end up having a difficult time figuring out what to do with all of these regulations, because there's nothing that's clear cut. You kind of have to work with your local towns, maybe your state if you're lucky, but there's not federal oversight. People end up being afraid because, well, if we use product A, how do we know product A is better than product B, which is better than product C? Because we don't have all these trials and studies that we tend to love. We like to look at our spreadsheets, we like to look at our data, we like to look at all these things that make us think that we have some sort of scientific plan, but it's not there. It is not there. So as a result of this, we just don't know what to do, because these laws and things are changing all of the time. And so yet it just ends up being another healthcare disruption where there's so many tumultuous waters, there's so many roads that we have to travel. It makes it very, very difficult for anybody who just want to stick their neck out and say, you know what, I'm gonna do this. And there are a few centers across the US that are doing very well with this, but we have a long way to go. This is one of the messages that I want you guys to take away, because we can all sit here, give each other high fives and powwow and have a good time talking about this stuff, but when you kind of get out there in the real world, it's different. People are going to start to look at you different. People may even start to treat you different. And for any physicians that are in the room now, if you're an advocate of this, you're exposing yourself pretty well too, because there are going to be a whole bunch of doctors that are going to be like, you don't know what you're talking about. What do you? They want to be the smartest person in the room, and they say, you know, I was never taught this. You guys don't know what you're talking about. And this is nonsense. So it makes it difficult even for the professionals to stick their neck out to say, look, I'm willing to help you. I'm willing to do something a little bit outside of my comfort zone in order to get us to where we need to be. So when I met this lady, she had some very interesting things to say, because she was quite well versed in the law, needless to say. She had some trials and tribulations of her own, so we had an immediate bond that day. And we were able to talk about some of these things in a way that, well, maybe only a few of us can. But she said that she's learned a lot of things over her life, and one of the things she learned as she was going through her criminal trials is that, you know, the stories out there will kind of take care of themselves and they'll be there. But she knows what she did, and she can live with herself because, well, she didn't do anything that was wrong. And in fact, she said this is what made her do some different things with her. And I'm like, you know, the first time I saw Martha Stewart and Snoop Dogg on the same TV screen, I said, what the heck is she doing? I mean, but it gave her an amount of boldness that was able to transform her and her career and take her to a different level. And yes, Martha's among us, and she has her own CBD line in development. And well, why not? So I know if the person on the right had his own CBD line, well, he'd be out of business pretty quick standing next to Martha and what she's able to do. But when you realize there are going to be so many options for people out there, and so many options for people to have their CBD, to have other types of cannabinoids, THC,
if it's not under some sort of regulation, people aren't going to know where to go. And so then they're going to be saying, well, who's the most popular? Or we're going to buy this by price. So maybe I'll just buy this gas station brand because it's only $4.99, but it says CBD on it, so it must be good. But as all of you guys know, that's not the case. That is not the case. But this is where we are today with the general public. They don't quite know what they're going for in this. And so we have to continue on. So let's take a few minutes before I wrap up and talk about the things that you can do. There are a few things that you can do when you want to be your own best advocate when running into some roadblocks along the way. And this can be within your business and trying to make additional business partnerships, or even for your own personal medical care. So the first thing, always want to ask questions, especially if this is for you and yourself as an individual who would like to get some treatment with CBD. So it's okay to ask questions, because remember, all of this time, you may know more about these things than your physician. It's a very good possibility because you've been doing your research and there's just not a lot of update. There's lots of things that people can do, but it's a choice. And it's not something that's mandatory to keep your board certification in any one subject. They don't say, oh yeah, you need to do some CBD training on top of this. So make sure that you're asking questions and you're having a dialogue with people. The second thing, particularly on the business side, we may want to provide additional information for people, because sometimes it's that knowledge deficit that gets in the way. And I didn't realize that there were some scientific studies and some pharmaceutical trials that are out there that help us learn to do some other things. And people may not be aware of it. If you don't run in these circles, you're going to be too worried about understanding the latest cancer treatment or understanding the new recommendations about blood pressure and heart disease, or any number of things that may make a larger mainstream splash. You're not going to learn about some of these other studies and developing things that are out there around CBD. The next thing to think about is forming a partnership. And getting that partnership comes from a number of different ways. So it starts with that communication and that relationship that you're building within one another, and that you're trying to get yourself there. You're forming this partnership because you're trying to either provide better care for yourself and you're being your own best advocate, or you are trying to say, look, you may be sitting on a solution within your companies that can make life better for many. And many of you that are in the sales space or the manufacturing space or even the growing space, you know how much time and effort and attention to detail that you've been trying to put forward to your product. So you really know what's going on. You know they've been tested for pesticides. You know they've been tested for other chemicals. You know that you're trying to put the best product forward that will have the least amount of side effects, the lowest probability of causing any harm, and the most effective treatment plan. And with everything, people may approach things with a little bit of skepticism. And that skepticism can come in small doses, it can come in large doses. But there's always a narrative going on in someone's head, whether it's on the healthcare side, whether it's in the CBD space, that, are these results really right? Is this really true? We need to have more studies. The answer to one study is always, well, we need to do more studies. And we may never get to that point because there are so many studies that need to be done. We need to approach it with some skepticism because we just don't want to start doing things that can cause harm. As if those of you that attended the keynote this morning, the vape problem is one of those. The CDC all of a sudden found themselves behind an 8-ball trying to figure out why people were dying with lung disease, why so many people were getting advanced lung disease, why people were needing lung transplants for vape pens. So you got to get your detective hat on and see what is going on. And so we probably know most of the ones that are more tightly regulated are probably okay. And maybe some of these aftermarkets or maybe some of the gas station brands that are out there that may be causing some of this. But again, we have to do more studies. We don't know. So I got a decent piece of advice from this guy. This picture here is iced tea and cocoa. And when I met him, I was kind of, it was a weird feeling because, you know, it's like, all right, well, this guy plays a cop on TV, special victims unit. I'm like, okay, my trauma is coming up. All right, calm down, calm down, calm down. And he looks over at me and says, hey, what's up, big homie? Are you talking to me? Ice, Mr. T, sir. I mean, no, Ice T. I'm sorry, not Mr. T. You're somebody different. And he said one of the most important things that he ever learned was don't trust anybody. I said, hey, all right, you have to explain that a little bit more. Don't trust anybody. And he just talked about throughout his life and his career in music, his career on TV, that a lot of people have their own motives ahead of your motives. And you have to be aware of that. And that's where this piece of skepticism. So I'm not going to say go as far as Ice-T and say don't trust anybody. But just as you're approaching these topics, as you're building these relationships with other providers and caretakers, know what you're dealing with and know what's coming next. And you're really going to get to that right space because it takes some time, it takes some community, it's going to take a whole lot more science, it's going to take a lot more cohesive legislation to help us get to the next level, where we really want to be with this. So there's not so much of a stigma. So there's not so much of a negative connotation to cannabinoid science and cannabinoid products. We need to do better, and we, being here today and spending some time this weekend, we are taking that step together. And I want to thank all of you guys for coming here to learn more about your side of CBD, wherever that may be. And I encourage all of you guys to continue to network and talk with each other, because I've had some amazing conversations with a lot of you that are here already, and learned a lot from a lot of people. And so that's the journey that we're on. Never close your mind. Never just automatically shut down. Try to keep an open mind about everything, because when we have these narrow focus and a narrow lens, it just doesn't do what we need to do. So I'm here to tell you guys, congratulations for being here, taking the time to educate yourself and to take these steps back to your communities and to your hospitals and to your physicians and to all of the other people that you're going to be working with in order to take us to this next level that we all desire. I will stop here, and I'll be happy to take any questions. My contact information is here. That's my cell phone number down on the bottom. You can reach out through me to LinkedIn or anywhere that we're able to connect. I'd love to further the dialogue. So I'll open it up for questions, and we'll start back here, and we'll put all the questions on the mic because of the cameras here.
Thank you for speaking out. I was on a panel yesterday. I'm a physician assistant, just graduated in 2015.
All right.
And I have had 0 teachings about the endocannabinoid system.
Wait. Can you say that again? I'm
Yeah.
waiting. I want everybody to hear that. So say slowly the year that you finished.
I graduated in 2015 with,
Okay.
I have 3 masters, all in science, and 0 of them have ever included at any point the endocannabinoid system, which is astonishing. And it just does a disservice to our patients. And it's only I got into this field, similar to most of the other doctors here, is because patients came to me and seeking care and getting great benefit. And you're like, what is this? I don't even know what this is. So thank you for speaking out and being, cavalier and making sure that this is moving in the right direction. Because if we don't, we're all going to be in trouble if everyone keeps making bad products. So.
You're absolutely right. So thank you for that, because I continue to poll a lot of our trainees that are training now, and they're in the hospitals now, and they're doing the academics now. They're still not getting it, and and a lot of them have graduated around 2010, 2013, but we're still hearing someone graduating in 2015, 4 years ago, never heard of it throughout all. Do you care to share how much you spent on all that education? You don't have to, but I'm sure it was 6 figures. It was 6 figures, and he didn't learn. You should ask for a refund. In fact, I'm going to ask for a refund too. Are there any other questions? We have some up front. We'll start here. I'll wait for the mic.
Thank you. This is maybe a little bit indirect, but I'm just wondering, you mentioned about, I think something to do with people working within the industry, and then people like cannabis is obviously becoming more and more popular. So when do you anticipate any policy changes, whether it's state by state? And I think a couple of states have done this with regard to drug testing and cannabis showing up, and then it's like, you didn't pass the test, you're out, which to me is so contradictory of, the other legislation, at least statewide, that says it's legal.
Yes.
So
this is a big problem, big problem. So thank you for asking that question. We are in the midst of this crux where states can regulate certain things, and so there are some instances where if cannabis pops on the screen, no big deal, keep working as usual. Regulated industries like commercial drivers, well, they haven't made it that far. There's a lot of federal oversight there, and well, we know with our current testing, well, it's not like the alcohol testing. And a lot of these industries are using it like alcohol testing. Well, if it's in your system now, that means you must have been drinking now, and well, that's unacceptable, you're going. Well, if your marijuana screen turns positive, that must have meant you smoked on your way in here, so you have to be gone. And that's not really the way to approach, because, well, even back when I went to school, we knew that there was a certain difference of how long this stays in your body and how long these tests may show up. And so this continues to be a difficult problem, and it plagues us at each level of this interaction. It plagues us at the hospital system level where, well, they're looking at physicians, nurses, and others who may use this as a treatment for their anxiety or something else that can cause a problem. And they don't know quite what to do with this. Well, do we let this good person go? Do we not? So they do have to make their own policies case by case. In Pennsylvania, I've been making some outreach to some of the senators and some of the proponents of cannabis legislation to talk about exactly some of these things that we need to reconcile. Because, well, an insurance company said, well, we get some federal money, so we're not going to even entertain any of that. We have to have a more cohesive strategy. And again, it starts having these relationships. So I go out and talk to these folks, letting them know that, well, from this aspect in the medical community, here are some positive things that come out of this. And there are some negative things that we could and should be aware of. But there's a lot that we need to do. And it really takes building those relationships, having these conversations, and unfortunately it's still in that one-by-one phase. And we can go into public forums and things like that, but we need to always be advocates and take these opportunities for us in order to do these things to make us better. So thank you. We had another question here.
Hi, I'm April with Opalife. So we are a team of CBD coaches, and we really want to be the bridge, I guess, between the physician and the patient, because they don't know. We know a lot more than they do. Some of our coaches are nurses and healthcare professionals, but no physicians. So I would like to know, not having a healthcare background, how we can best approach these physicians. How can we, I would be making the calls, right, and try to get in front of a group, not just one by one, but speaking one to many. How can I approach these medical offices and get in front of a group of physicians to do a brief presentation on or CBD and how it can benefit the patients, how we can be a potential resource. So when I call these offices, it's like sales, right? I call and I'm going to be like, how can I reach these people?
It's very hard because it goes back to some of the earlier things. People build up walls. They don't want to hear. They're thinking, you can't possibly teach me anything that I know because I went through all this training and schooling and all of this. So sometimes it needs to start on a one-on-one kind of thing. You may need to recruit an additional person, that you can establish a relationship that is at least open to understanding CBD, okay? And once you get that person involved, it can make it a little bit easier to get in front of hospital systems. It can make it easier to get in front of a medical staff meeting, for instance. Another suggestion I would have for you is reach out to your local medical society. Usually in states, they're either regionally bound or county bound, but you can look for X county medical society, and there probably will be one.
Society.
Medical society. And they're usually advocates for doctors and other people, and they usually will have some meetings. And most of the people that you'll be talking to in the office of these places aren't healthcare providers, so they won't put that bar up there and say, well, you can't talk to me because you're not a doctor kind of thing. And you can build a relationship on that level. They may invite you to come in 15 minutes at one of their meetings, and then you get that opportunity of one-to-many. So you have a tough job. There's no doubt about it. I can't even imagine the challenges you must face in your day-to-day routine. But it may start with just getting a couple of docs on your side who are willing to hear you out on a one-on-one basis. And they'll be able to help get you in front of more and more and more. But definitely reach out to your medical societies as well, because I think that'll be a good place to start. Because people are talking about this. They'll act like they're not.
Right.
They'll act like they're not. They're behind closed doors. They're talking about it. And they're screaming, saying, what are we going to do? What are we going to do?
Well, and the patients are talking about it with their doctors. They're asking about it. They're saying they're using it. So the doctors are hearing about it.
And they are.
Yeah.
And the problem is there's just so much to know. If you saw the slide they had in the keynote this morning, there are all these products with all these names and all these different concentrations, and it's not like any other medication that we prescribe on a routine basis that has a standard dosing, standard regimen, and going from there. So there are some complexities there that make it challenging, but start with one and you'll soon get to many.
Yeah, and I was even thinking, because physicians are so evidence-based, there are a lot of studies.
There are.
So if I make just a resource sheet for the different, all of the studies with the links, and they can just go right there and they can look to their heart's delight.
They will.
Yeah.
We're trained to be critical, so then they may want to come in and have something that we call the journal club, where we get this great article that's very well written and maybe has some breaking science in it, and everybody just destroys it and tears it apart. They misspelled the on the third page. They don't know what they're talking about. And you go through some of those things. But it can be tough. But providing information is certainly something that you can do. A resource sheet could go a long way.
Okay, thank you.
Another, as you talk about education for the medical professional, you might already be aware of this, but the University of Vermont School of Medicine has that professional certification for licensed medical professionals to be a cannabis consultant. And it's scientific, it's through the School of Medicine. So that, I think, is something that all medical professionals should take, and even people who aren't medical professionals, because that is taught by the School of Medicine. It is evidence-based, and it's relatively affordable. It's all online. I think it's like $2,200. So I think that's something that everyone could benefit from as well. So
you're right. There are a number of emerging resources for certification, for learning. Many states have different criteria. If, like for instance, in Pennsylvania, if you want to be a recommending physician for cannabis products, you do have to go through a certain amount of training. So, but each state is different, and you're right, that is one of the programs that are really trying to do a good job with science. So we're getting there. Yes, we are getting there. But before it gets embedded across the nation, for all of our future trainees. It's going to be a struggle for us. Thank you. Any other questions out there today? Yes, Doctor.
As they said in the keynote, a lot of people think that we're not talking about cannabis because we're not getting paid to by these pharmaceutical companies, which I'm so glad she debunked, because I'm like, I didn't get paid. I've worked at the VA for 9 years. I didn't get paid to prescribe anything. But I think what it is more, and this is, I'd love to hear your opinion on this, is it's our fear of litigation, because there's generally a gold standard algorithm. If your glucose is over this, at this point, then you give this drug, which is generally metformin. And like, since cannabis isn't in any of those gold standard flow sheets, I think that there's that fear of like, if something goes wrong and I happen to say, hey, maybe try cannabis, and something goes wrong, well, since it's not in this gold standard, I'm more liable for malpractice. I think that's part of the fear.
Yes. So this is yet another disruption in the medical community. Having this whole litigation atmosphere that we are a part of, a lot of us, this drives our decision making. And this is why people are unwilling to go outside of those lanes that we talked about earlier on. I'm staying in this lane, this is what I'm taught to do, and I'm gonna walk right down this line, because if I stutter, all hell is gonna break loose. And this is exactly what we're talking about, because there's so many different products, there's so many things. It is really hard for someone to recommend unless they're doing a lot of research and they understand the products available in their community, where to get them. It's extremely difficult, and there'll be lawyers, there'll be attorneys that will come down the road and tie people up in these lawsuits that will come, because each decision a doc makes, they're worried about litigation on some sort of way. So thank you for bringing that point up, because it's a huge problem with where we are in our medical society today. I think I have time for one more question or comment.
My quick comment was that I would also doubt that your medical malpractice insurance would cover something cannabis related, because if you're prescribing something that's not, acknowledged as being one of the things on the formulary, then you're not going to probably be covered.
You're absolutely right, and that goes along the federal and state and guidelines and all these things that are going on that really make it difficult for us to get the job done. So thank you guys for being a great audience today. Thank you guys for learning.